Hi, good afternoon to all the viewers of Sakra page. Today we have our Dr. Rajendra S. Gujjalanavar, HOD and Senior Consultant of Plastic Surgery to discuss on rhinoplasty. Good afternoon, Doctor.
Good afternoon.
Welcome to Facebook Live.
Thank you.
And the first question today is like, what is rhinoplasty?
Good afternoon to everybody. See, as a term itself shows that the rhinoplasty. Rhino means a nose, plasty means shaping. So it's basically a shaping a nose, or reshaping the nose, or a nose job, commonly called in a general term. Uh, this is a to the rhinoplasty is done for various reasons. Basically, it is a reshaping the nose for two reasons. Basically, one to improve the appearance so that it nose should be in harmony with the rest of the face or in proportion with the rest of the face. Other commonly condition where we do rhinoplasty is whenever they have a breathing problems, where there is a deformity inside the nose which causes a breathing problem along with the external abnormality or a change abnormal shape of the nose, or sometimes it is for both the reasons, either improve the appearance or to improve the breathing problem. And it is usually done or commonly done both men and women. There is no specific gender specificity, and it is usually commonly done in between the age 20 to 50 years, because they are more conscious about that, and whenever there is a breathing problem it can be done anytime. And this is one of the delicate surgery, and it is most commonly done cosmetic procedures in plastic surgery.
Okay, doctor. Who are the candidates for this surgery?
Uh, I already mentioned that this is rhinoplasty is done for two reasons. One is for the improve the appearance, this is called a cosmetic rhinoplasty, and other one is functional, where there is a problem with regard to the breathing. So most common conditions we see, or most commonly patient come with like a broad nose, deviated nose. Some people having some hump on the on the nose, front of the nose, and few patients come with a long nose or a short nose or a drooping nose, or in some very badly collapsed nose. Yeah. So along with that, patient may be having a problem with the second center in the nose. There is a separation, two sides. So there is a partition, so which is called a septum, which also deviates and causes a lot of breathing issues, like they cannot breathe with one nose. So that associated with a lot of changes in the nose, soft tissue changes. So these are commonly common conditions where we do rhinoplasty. Along with that, there are some congenital, by birth only patients have some nose deformities. So where we do the rhinoplasty, and other thing is congenital, like nose deformities by birth, and along with that some people have a cleft lip and palate associated nose deformities, or sometimes patients having a abnormal head shape, it's called a craniosynostosis. Along with that there is a nose problems, and these are conditions where it is associated with the congenital. So in these cases also we do the rhinoplasty to improve the appearance, and also this is commonly see these deformities uh, 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 other than the birth defects. It's commonly due to any injuries and infections, sometimes due to cancer resections and other various causes where the patient presents with these nose deformities.
Okay, doctor. And the benefits of rhinoplasty, doctor?
Benefits are different for a different kind of a patient. If a patient is coming for a cosmetic rhinoplasty, uh, the reason being they come for a change is they are not very happy with their nose, and they are very unhappy because it is not in harmony with the rest of the face, and they're facing a problem, and they are not self-confident because of this abnormal shape of the nose. So whenever we do the rhinoplasty for the cosmetic reasons, it improves the shape in proportion to the face. So when the benefit out of that is they look much better, their confidence level will improve, and they become more confident. So this is for a cosmetic rhinoplasty. When it comes to a functional problem like a breathing problem, uh, they have a lot of associated when they have a problem, breathing problem due to changes abdominal nose shape, and they also associated a lot of insides of tissue. So when we do the rhinoplasty for the functional problem, they're very happy with their breathing pattern, and they're more confident also. And so these are benefits out of rhinoplasty.
Okay. How do you prepare patients for rhinoplasty?
So when the patient come for a rhinoplasty, we do one or two consultations before going into the surgery, and it takes a long time, the consultation, because a lot of things has to be addressed both the sides. So when they come, we'll just go through the history first. Is there any injury or any other problem, or is there by birth? So when we take a complete history, and we discuss with the patient what is the problem with them, what they don't like in their nose, basically in terms of a cosmetic rhinoplasty. So we assess, we analyze both the history part, their examination part. We analyze and come out with what are the problems and what is the deformity, how can we correct. So we discuss everything with the patients, and we'll come up with a plan to do the what is to be done, and we discuss with it. Then again we call the patient again second time, because these are cosmetic procedures. We have to discuss once or twice with the patient before going into the surgery. And also all these patients undergo ENT examination, because most of the times they have associated nasal passage blockage problems, and so many things. So ENT evaluation, if anything obstruction causing nasal pathology causing a obstruction, we try to address at the same time along with the rhinoplasty. So it's and subsequently we take all the precautions in terms of if the patient is on blood thinners, we stop all those things. So and also it is evaluated by the anesthetist and other concerned people, so that once everything is complete evaluation is done, then we plan for the surgery.
Okay. And types of rhinoplasty, doctor?
The rhinoplasties are of two types. Basically, where we will spot, one is called a closed rhinoplasty, another is an open rhinoplasty. So difference between the closed is where we make a very small cuts. All cuts are small cuts inside the nose, nothing in the outside. This is with that small cut we do the all the rhinoplasty. So, but this is not suitable for all the patients. It is for very smaller deformity, smaller correction is required, or basically in the top of the nose where minimal correction is required. This closed rhinoplasty is done. Even for other things also done, but it's ideally it is done for the minimally smaller corrections. Other one is open rhinoplasty, where we along with the inner cuts, a small cut is made on the undersurface of the nose, so that we can completely open the nose and do the complete corrections in terms of external correction, internal correction. And the once the wound heals, even in the open rhinoplasty, the scar will be very minimal. So it's not so visible, and also on the undersurface. So not much of a difference in terms, except some the swelling is little more in open rhinoplasty, but over the time that will subside. So these are two types of rhinoplasty: closed and an open rhinoplasty. Yes.
Okay. What happens during the procedure?
See, it's a patient. It's a general. Normally we do under the general anesthesia. So we do prepare the patient for the surgery in terms of a blood test, anesthesia checkup, and everything. And patients undergo a sedation, or patient undergo general anesthesia along with the sedation, and we prepare the patients. We clean it, we'll drape it, and we'll do a cut depending on the open or a closed rhinoplasty, and we open the nose, and we do correction, all the corrections. Sometimes we require a extra bone, so or a cartilage to strengthen or stabilize the nose. So if we get everything, the nose only will use that, or sometimes we may have to take it from the chest or the groin area, extra cartilage, so that we can make a solid, sort of stable nose. And after that, we close it and we put some splints and dressings, and it usually takes around 2 to 2.5 hours depending on the type of rhinoplasty. And post operatively patient will be in hospital for 1 day.
Is there any risk associated with this surgery, doctor?
See, this is the rhinoplasty is a surface surgery. Usually, it is a safer surgery if it is done in a proper way and by the qualified doctors. And there are some risks which are very temporary, like a swelling, bleeding, some blockage of a nose because of a clot, and sometimes numbness and infections. But these all are simple, like a temporary risk, which can be corrected, which is settled in within a 3 to 4 days time.
Okay, doctor. What can a patient expect after rhinoplasty?
Uh, what can expect? Okay, it's basically it all depends on what what they want. If they come for the cosmetic procedure, cosmetic rhinoplasty, their nose shape will become much better than before, and their the nose shape in harmony with or in proportion with the rest of the face. And if they have come, so their nose shape will become better, and they are more confident in their daily activities or day to day. And if they come for the blockage or obstruction breathing problem, they'll be feel better. Their breathing pattern will be better, and so they don't have any problem with the breathing.
Okay, doctor. Are the results of rhinoplasty are permanent?
Yes, the results of rhinoplasty are permanent until unless if there is any subsequent injury, anything. And also as the age progresses, there some changes will happen. But when we do that, it is a permanent procedure.
Okay. Is it safe, doctor, rhinoplasty?
Yeah, rhinoplasty is a safer procedure, provided it is done in a proper way, and it is done by the qualified doctors, plastic surgeons, or doctors. So it should be qualified in terms of doing rhinoplastics.
Okay, doctor. And thank you so much, doctor, for your valuable insights. And viewers, to book an appointment with our doctor, you can log on to Sakra www.sakraworldhospital.com, or you can just call us on the numbers which is displayed over there to book your personal appointments with Dr. Rajendra. And thank you for joining us. And do keep following us on all our social medias so we keep you updated on all the health tips. Thank you.
Thank you. Thank you so much.